Hello, this is Dajhanna Flores. Today I will be doing my second speech. These are my audience members.
Hi.
Hello.
This is my ID. And these are my note cards. Before beginning my speech, there's a question I would like to ask all of you guys. Do you guys know what food insecurity is?
No.
Okay. One out of five. Even though food insecurity is a significant problem in our community, many do not know what the term refers to. Even though initially it may seem like a faraway issue, it is actually closer than you think. It is affecting real people here in our community. It may be someone you know, perhaps a neighbor, a friend, or a classmate, or it may even describe a situation that you are going through. Either way, it is important to know about this issue because it is affecting the people around us. And being aware of an issue is the first step to bring about change. There's 3 things I would like you guys to know with this presentation. 1, what food insecurity is. 2, who is affected by food insecurity. And 3, how these individuals' health is impacted. So we can start with the basics by looking at what food insecurity is. According to the Department of Agriculture, food insecurity involves a lack of consistent access to enough food for an active, healthy life. Initially, this may sound a lot like hunger. However, it's important to distinguish between the 2 terms. Food insecurity is not a synonym for hunger. According to the U.S. Department of Agriculture, hunger is an uneasy and painful sensation caused by a lack of food. However, on the other hand, food insecurity takes into account the quality of the food that it is consumed. So it not only refers to a lack of access to food, but a lack of access to safe and nutritious food. Therefore, it is important to think about that someone who is food insecure may not necessarily be hungry. For example, someone is maybe eating ramen every single day. So they are not hungry. However, the food does not give them the necessary nutrition for a healthy life. So this individual can still be food insecure. So now that we have gone over what food insecurity is, we can take a look at who is affected by food insecurity. Food insecurity doesn't have a specific face. There are different populations that are affected by it. A number of factors play a role, including income and unemployment, ethnicity and race, as well as disability. All these impact whether an individual has the means to meet their dietary needs or not. Another factor that may play a role is also location. Some populations reside in areas that do not have supermarkets or grocery stores, so to acquire the necessary food, they may have to go to a different city or town. However, the problem is that not everyone, sometimes the distance is too long or there's a lack of transportation, so they're not able to go. When this happens, they are restricted to acquire their food from the small stores in their area that may not carry the most affordable or the most healthy food. We can also find these populations within our own community. Data from the Feeding America reveals that 1 in 8 Nevadans are food insecure, and like this image shows, 1 in 5 children also struggle with this problem. We can even bring the problem closer to home and look at food insecurity within our own campus. A survey by the ASUN office and 2 other offices revealed that 22% of UNR students are actually food insecure. So college students are a vulnerable population likely to experience this problem. So we have looked at who is affected by the problem, but that also brings up the question, why should we care? It is important to consider how food insecurity impacts the individuals. There's a number of areas that are affected by food insecurity, including individuals' health. The Office of Health Prevention and Health Promotion revealed that individuals who are food insecure have a higher risk of experiencing obesity. They also have higher rates of chronic disease, including high blood pressure, chronic stress, and diabetes. So there's a lot more health issues that these individuals may experience. A study in the Health Services Research Journal also revealed that food insecure individuals experience higher rates of going to the hospital, so they have higher expenses related to healthcare because all this is due to the health complications that arise. So all of this shows that these individuals are significantly impacted by their lack of access to healthy, nutritious food. So this is an important issue that we should take a look at. So in conclusion, food insecurity is a significant problem affecting individuals in our community and individuals in our own university. There are thousands of people who don't know where their next meal will come from or if they will have anything to eat at all. Additionally, sometimes in order to meet their hunger and their needs, they may eat food that's not necessarily healthy or nutritious, and this can impact their health in serious ways. Therefore, we have to take a deeper look into this issue and try to address it in order to improve the lives of these individuals. Thank you. Okay.